This video demonstrates clinical examination of a young patient with goiter. This involves inspecting the neck for swelling, palpating the thyroid gland for size, consistency, nodules, and lymph nodes, and auscultating for thyroid and carotid bruit. Assessment of functional thyroid state like euthyroid state or signs of hyperthyroidism or hypothyroidism must be done. This includes checking heart rate, demonstrating fine tremors of hands, reflexes, skin texture, and performing thyroid function tests to evaluate hormone levels.
A quick thyroid examination includes inspection for any swelling, palpation for the size, consistency, as well as presence of any nodule, single or multiple nodule in case of multinodular goiter, and noting the consistency of that nodule as well. It may be a cyst or maybe a nodule. In case of suspected malignancy, their regional lymph nodes must also be palpated. Then a clinically hyperactive gland, the increased blood flow to the gland may produce a bruit, so auscultate for a bruit over the thyroid gland. A large thyroid gland can press upon to the adjacent carotids and sometimes may be responsible for say carotid bruit as well. Similarly, a malignant gland may, or an infected gland may have some regional lymph node enlargement. So note all these things if depending upon the situation or status where you are examining. Checking for the status of a thyroid like hypothyroid or hyperthyroid state or a euthyroid state. The important things are to notice the pulse, notice sweating of the palms, coarsening of the skin, check for the reflexes if you are suspecting hypothyroidism, check for the tremors in a suspected case of hyperthyroidism or thyrotoxicosis, and then look for the eye signs like proptosis, absophthalmos, leg or lid traction when hyperthyroid is being suspected. Check for the edema or non-pitting edema in a hypothyroid state or pretibial mixed edema in patient with Graves' disease.
This young man presented with complaints of palpitation. On inspection, there is visible swelling in front of the neck. A single nodule 3 by 3 centimeters soft in consistency was noted. There were no signs of hyper or hypothyroidism. Thyroid hormonal assay was normal. On ultrasound, a cystic swelling was noted. A diagnosis of a colloid cyst confirmed on FNAC.